The idea of Medicare for all has been gaining traction ever since Bernie Sanders was campaigning for president in 2016. Since then, dozens of current Democratic Congress members have begun supporting it. They've been supporting single-payer health care. Many Democratic candidates have made the issue an integral part of their platform and of their candidacy. Senators Elizabeth Warren, Cory Booker, Kamala Harris, Kirsten Gillibrand, they're all viewed as leading candidates to receive the nomination, the Democratic nomination in 2020 for president of the United States. And they all now support the idea, even though I don't know that they supported it in 2016. And even last week, a group of over 60 House Democrats founded a new caucus called the Medicare for All caucus. So again, this idea is definitely on the rise. So on Wednesday, the administrator of the Centers for Medicare and Medicaid Services, CMS, said that Medicare for All would be a bad deal. Seema Verma, who was nominated by President Trump, said in a speech at the Commonwealth Club in San Francisco that adopting a single-payer health insurance system would negatively impact the health care of seniors. Verma also said that this would occur because by expanding Medicare coverage to include younger people, it would drain the program of funding, which would mean that the seniors that so desperately need this health coverage wouldn't be receiving it.
Okay. Oh man, knowing that this is a Trump official, I won't assume one of the either or both. I'm not going to assume she doesn't know what she's talking about, because that could be actually true. Mm-hmm. But I'm just going to assume she's just trying to misinform people, because you cannot actually look at this issue and I guess objectively see what this Medicare for all program that they are proposing will do negatively.
Right.
You know what I'm saying? You can't actually say that without looking at the facts behind it. It's definitely not some sort of transfer. You're not transferring care away from other people. And it's an expansion. It's not like they're going to funnel more people into the same existing program, as it's being funded currently. That's kind of the idea she's trying to put across. I mean, under the Medicare for All national healthcare system, the funds, or the majority of funds, are going to come from eliminating current government programs like TRICARE, CHIP, government employee insurance, current Medicare, current Medicaid, current ACA. That's where the majority of the cost saving is going to come from. Mm-hmm. Also, the elimination of what is going to happen? The elimination of the healthcare industry.
No doubt.
That's where the majority of the overhead costs is associated, is with
the middleman.
The middleman.
Yes.
And it's elimination of the health insurance industry, not the elimination of providers.
No, not doctors, not nurse practitioners.
That's what
none
she's
of
trying
them.
to make it
Right.
Is the government's going to be doing all? It's those people are not going anywhere.
Right.
And for the most part, healthcare providers actually agree with Medicare for all. Mm-hmm. They even agree with the ACA, even with its loopholes. Yeah. But they understood that it could be better. Mm-hmm. But most medical care providers agree that our system needs to be reinvented, needs to be overhauled to a system that gives more people access.
Right, because of course they want their patients to be as healthy as possible. She is promoting a fallacy just to rub dirt on the whole idea of a single payer health plan or a single payer health insurance system. The idea that she would say that seniors wouldn't get their coverage because there would be more people involved, younger people involved. Like Mike was talking about, you're assuming that, or no. You're trying to promote the idea that there's only so much funding, right? There's not going to be any more funding. We're not going to expand funding whatsoever. So we only got this much money to dish out to all the seniors. And if you pack this small circle that we have with younger people, it's going to explode. There's not going to be any money for anybody. So we want our seniors to have coverage. But then it's like, hold on. So you're advocating for a system that it's a Medicare for all senior system.
You like that.
That's like okay. That. But you don't like a Medicare for all everybody system? Like, this system is good for seniors. You want to make sure that they get all the coverage that they need. But everybody else, no, it's okay if they don't have all the coverage they need.
They're just trying to like play people against a group of people that is very sympathetic, which is our elders and our seniors. You know what I'm saying? That's pretty easy.
By choosing a socialized system, you are giving the government complete control over the decisions pertaining to your care or whether you receive care at all. It would be the furthest thing from patient-centric care. Again, so she's bad-mouthing a plan that she approves of for seniors, this socialized system. You're giving the government complete control. Again, so you're comfortable with giving the government complete control
of the care of seniors.
But for everybody else, that's a bad idea. It's not patient-centric. Like, look, Medicare is a very popular program. And the reason why is because seniors can get coverage. They can get health coverage. A lot of these seniors are living on fixed incomes. So they can't like enter the private healthcare market because it's just too damn expensive. Now, can it be better? No doubt it can be better. There can be improvements made along the way, more funding in it to give these seniors more help, the more help that they need. But to say that this program isn't patient-centric, that's a fallacy. Like, if you're talking about patient-centric, that has to do with your doctors. That has to do with your providers. And your doctor and your providers, again, they want the best coverage for you. They want you to come into the doctor and make sure that you're getting the treatment that you need. You just need a health plan that will foot the bill. Mm-hmm. And what this Seema Verma is saying that, like all of this is great for the seniors, the oldest of us, but for younger people that have not quite reached 65 years old, be left to your own devices. This isn't a good plan for you.
Left to your own devices. And what would those devices be? Like your lack of health? You know what I'm saying? Because it seems like Republicans kind of, expect a large percentage of people to accept their cheap, inconsequential coverage or no coverage at all, right, and just die slowly rather than, advocate for, providing them with some sort of market alternative, right, to healthcare. And again, she's at that little last quote you read off from her. That was like an articulation of that propaganda narrative, right, of the government deciding what healthcare you get and being in total control of treatment. And like I said before, like we both have said, do healthcare providers go away?
They don't. And just one more comment that she made. She said that CMS is likely to deny waivers from states that are seeking to implement their own single-payer systems. And so she said, while the agency wants to promote flexibility, quote, I don't think a single payer system is going to work, and it doesn't make sense to waste time on something that doesn't work. How the hell would you know that single payer does not work? It's working just fine for Medicare recipients, right? It's working just fine for numerous countries all across the globe. How the hell would you know that single payer won't work? Did you try? Did I miss it? Was it implemented and then it was retracted? Did this happen and I just missed it, right?
So basically, like, what we're trying to say is she's full of shit.
She's completely full of shit.